Hello everyone and welcome today to the ITBA for our breeding season preparation workshop. My name is Hannah Marks and I am the Education Coordinator with the ITBA. We are so delighted to welcome everyone here today. This is the first event since, I suppose, lockdown began back in the ITBA, and we're also hosting our first hybrid event with a wide range of members also viewing online. A big thank you to all of our speakers. We have Andrea Ryan from Kilcash Equine Clinic, breeder and consignor Olive O'Connor, Lorraine Fradl of Connolly's Red Mills, and Micheál Orlandi of Compas Equine. It's great to be able to have them here today, draw on their wealth of knowledge, and also thank you for giving us all your time this afternoon. I'd now like to welcome our first speaker. Andrea is going to talk to us about postnatal care of the mare and foal. Andrea has over 20 years experience in equine practice. During this time, she has worked in England, New Zealand, and then returned to Ireland to set up her own veterinary practice. She jointly runs Kilcash Equine Clinic, and her main area of interest is stud medicine and reproductive problems in barren mares. Thank you very much, Andrea.
Hi Hannah. So at the beginning of the breeding season, it's important to try and identify which mares are going to warrant extra care. Those are your high risk mares. They might have had previous abortion, previous difficulties foaling, some other illness, laminitis, or other conditions such as hydrops, or maybe have had placentitis before. So it's important to identify those mares and, if necessary, put in extra plans for those, or maybe send them to foal somewhere where there would be just that extra level of care available. But assuming that your mare is a normal mare, then I think it's important to think about where she's going to foal. Horses, I suppose, ideally in the wild would foal outside in a clean environment, and they're not entirely designed to foal in stables, but that's what we do, particularly when we're foaling them in the thoroughbred breeding season. So it's important to realise that when they're in their own stables, they're going to be exposed to fecal contamination, and that can be very dangerous for the foal, because newborn foals are born with an open gut wall. The colostrum is absorbed through the gut wall when the foal is just born, and that remains open for about the first 12 hours of birth. So anything that the foal comes in contact with at that point can get across the gut wall and into the bloodstream. So it's very important that newborn foals aren't born in dirty stables where there's a lot of fecal contamination. So a clean stable, well bedded with clean straw and very regularly mucked out around the time of foaling is important. Then, because foals need colostrum in order to build up good immunity, and that needs to be absorbed in the first few hours, it's important, if you're going to foal mares at home, to consider whether you have a colostrum supply or whether you have access to one from another farm. Because if your mare runs milk before foaling, or if for some reason doesn't produce enough milk, or the foal doesn't drink it in time and the colostrum is lost, then you need to have another plan in place to give the foal an alternative colostrum supply, or otherwise you're going to end up having to use plasma instead. And also you're going to delay that colostrum intake into the foal and that gut wall closing over, and the foal is going to be more at risk of infection. So delayed nursing and delayed ingestion of colostrum is quite a high risk for sickness in foal. So it's important to have a plan for alternative colostrum if needed. Ideally, if the mare is quiet enough to do so, the mare should be washed down her hindquarters and her mammary gland with warm water and soap and dried off, because newborn foals always some of them are great and go straight on to the mammary gland, but more often than not they tend to nuzzle around the mare's flank, stifle area and hindquarters. And if that area is dirty and has fecal contamination, then you're at risk of infection from foals. So if possible, once she's getting close to foaling, she should be washed down and should be nice and clean and dry for the foal. It's important to remember that most foal diseases, particularly in the first few days of life, that the oral source of infection is actually probably more important than through the navel. So people tend to be very concerned about disinfecting the navel, but sometimes forget that actually the oral route is probably even more common. So hopefully you have all that organised, a nice clean bed, supply of colostrum if needed. You get an opportunity to wash down your mare, and then finally it's important to have the correct foaling kit and contact detail of the vet who's on call, or a vet in your area that you can contact. Ideally, if at all possible, avoid interfering with mare when she's foaling. Those pictures on the right demonstrate the position that the foal is in immediately prior to foaling, and then how they turn. So they start upside down with all their legs tucked in, and then in the first stage of labour, when the mare is getting up and down and rolling around, that's when they extend their front legs and turn on their sides. And so a lot of times when the waters break in a mare and people see feet coming, if they're coming upside down, sometimes people can kind of panic and think the foal is coming upside down, but it's really just that the mare hasn't had a chance yet to fully turn that foal. And a lot of times if you just wait 5 or 10 minutes and let her get up and down once or twice more, she'll do that job and the foal will turn and come normally. So I think it's just important to remember that they don't sit there in the correct position, that they only really get into position in that first stage. So if at all possible, try to avoid going in too quickly and manipulating them, because if you pull from the second picture down, if you start pulling the foal when it's in that position, it's quite easy for that head to drop down under the pelvis, and then the next thing the head is stuck. Whereas if you just wait a little while, the foal will naturally turn and come out correctly. It's worth obviously thinking about a red bag foaling and being ready to act if that happens. And Olive, I think, is going to talk about that, about cutting open the red bag and delivering the foal as an emergency. And then have a little plan if what you're going to do if things aren't going to plan. So stage 1 of foaling is that time when the foal is turning and the waters the foal is turning through the bag, and then the end of stage 1 is when the waters break, and that's the start of stage 2, which is the delivery of the foal, and then stage 3 is the delivery of the placenta. So stage 2 normally takes 20 to 40 minutes. I suppose we all think mares foal in about 2 minutes, but they don't. And that amount of time, that 20 to 40 minutes is really, I'll explain later when we talk about neonatal maladjustment syndrome, but that amount of time is very important for the foal's hormones to kick in, to change its mental status from being asleep in uterus to being awake and able to drink its mother. So really, I think when you get to that stage of foaling, just maybe look at your watch or look at your phone and take note of the time, because sometimes people think an awful lot of time has gone by and they rush in a panic to foal, but actually it does take a minimum of 20 minutes if the mare is doing it correctly for that foal to come through the birth canal. So try not to intervene too quickly if you can. And then, as I've mentioned before, hygiene is really, really important. I know a lot of people like to put a hand in and see if everything's going right and see if they can feel a head and all of that. But I suppose just to be aware that mares can be particularly prone to metritis at this point, when their cervix is open and the uterus is open. So any contamination of the birth fluids can lead them to develop a metritis and quite a severe infection. And also the foal, as I said, has no immunity, so a dirty finger in its mouth can lead it to an infection as well. So if you do want to do a vaginal exam, just make sure that the mare is clean, her tail is wrapped out of the way, your hands are clean, and ideally gloved as well. And as I've said, allow enough time. We'll just go through that after when we go to the neonatal maladjustment. So assuming that everything's gone well and the foaling has happened and foal has landed nicely, then that sort of first period after birth is really important time for the mare and the foal, particularly for the foal. So just an easy way to remember is, I think 1 hour is the normal time by which the foal ideally should have stood up, 2 hours normal time by which the foal should have had a drink, and then 3 hours normal time by which the mare should have passed the placenta. Now there are circumstances where a perfectly healthy foal won't be up. in an hour. Sometimes a very big foal, big cold foal, be a little bit slow getting up, and there'll be nothing really wrong with it other than, you know, it's just a little bit tired after foaling. But they're just a guideline, you know, of at what point to start to think that maybe something isn't going as it should be. So I don't know if you do it in your place, Olive, but some people will feed colostrum to the foal before it drinks from the mare itself. I suppose there's pros and cons to it. The benefit of feeding colostrum to the foal before it gets up to drink is that you're putting colostrum into that foal's stomach and into that gut really quickly, and you're helping it get those colostral antibodies straight away. Once the antibodies start to be absorbed by the foal, that triggers the gut wall to close. And then obviously once it closes for colostrum, it will close for other things as well, bacteria. So the sooner the foals drink, the better protection they have against taking, you know, other infections in and things like joint ill. So in theory, it's a good idea to get them to drink as quickly as possible. There's a couple of downsides, I suppose. One is you might milk a mare, take her lovely colostrum, put it into a bottle, and then the foal won't drink it. And then you're stuck either dumping it or calling a vet to come out and give it by stomach tube. And the other, I suppose, downside would be that if you're not experienced at bottle feeding foals, that you can inadvertently cause the foal to drink the colostrum and drink it incorrectly and take it down into its airways. So it's important to have a bottle with the teeth that doesn't have a huge big hole in it, so that it's not going to just pour into the foal's mouth. So I think in hands that are comfortable doing it and are experienced, I think in principle it's a good idea. I think you need to, if you're going to feed the foal yourself before it drinks from the mare, you need to do it pretty quickly, because once they're up and had a drink from the mare, they won't really be interested in the bottle. And I think also it wouldn't be something I would do in a mare that has very little colostrum, because if you've taken the colostrum and the foal doesn't drink it from the bottle, then you've maybe interfered with the foal's chance of developing good immunity by just getting up and drinking itself. So some people do, some people don't, and I think it's probably a little bit of a personal choice. And then, as I said already, I keep saying it over and over again, the mare's udder and hindquarters are the main source of infection for a foal. So the placenta, if it's hanging down, hasn't been passed, should be tied out of the way, maybe just tied up. Tail should be tied up or bandaged if she's got a wet tail, dirty tail, and any dirt in the hindquarters should ideally be washed off or have been brushed off earlier before she foals. I think people often think that the main source of infection for foals is through the umbilicus, through the navel, but actually it's through the mouth. So the vast majority of infections in foals come through the oral route, and I think that's just really important thing to remember. No matter, you know, even when we put our fingers in foals' mouths to see if they're sucking and all that kind of thing, just to make sure our hands are clean. Because everything that goes into their mouth in a brand newborn foal will go it's pretty much into their bloodstream. And then you do need to disinfect the navel as well. You can use either iodine or Hibiscrub. Most people prefer iodine. I think it's important not to use iodine that's too strong, or you can burn the stump. And then I'm sure Olive will discuss this, but you can either spray it or dip it. I think dipping it is better, and probably dip it a few times to make sure that that iodine gets right up into the navel. So if the foal hasn't stood up within your hour, you might need to think about why. So there's probably two main reasons, I suppose, is that either it's got severe contracture of its legs or something like that, so it can't support its own weight. So that might need to be supported with splinting, or sometimes even just helping hand to get the foal up. And often within a few hours, those contracted legs will start to improve. If it hasn't had a drink within the first couple of hours, then we need to think why that hasn't happened. We'll go through that in the next slide. And then obviously if the placenta hasn't been passed after 3 hours, then you might need to intervene with that and consider whether she needs help to pass that placenta. So this is tiny writing, so I'm going to apologise for it, but I'm going to go through it. I tried to highlight the topics anyway, so at least they could be seen. So what to watch out for in the first few days to know if your foal is well or not. So I suppose the first thing that can become apparent very quickly in the first few hours is a condition that keeps getting named and renamed, but we're back to calling it neonatal maladjustment syndrome. And that would be your dummy foal. That's your foal that doesn't seem to be able to drink, maybe doesn't really have good affinity with the mare, that every time you come into the stable acts really startled and might be trying to find milk in the corner of the stable rather than from the mare's bag. There's two main reasons that can happen, and the first one, I suppose, is something that we've only become aware of in the last few years, and that's really when the foal passes too quickly through the mare's pelvis, and that doesn't have time for these hormones to be triggered and stimulated to cause the foal to wake up. It's quite a big topic, so I'm trying to condense it, but basically foals are asleep in the mare's uterus. I mean, you couldn't have a foal kicking and jumping around the place the way human babies do in a mare, or they would cause a lot of damage. So they're actually quite sleepy in the mare, and then to be able to get up and feed so quickly as foals do, they need to wake up. And so that's a hormonal situation that happens whereby there's a high level of these pregnenolones. They drop down as the squeeze happens on the foal passing through the pelvis, and that causes the foal to wake up. So sometimes maiden mares who'll just push foals out really quickly, or over excitable staff who'll pull foals out really quickly, that can happen. That can cause the foal not to be fully waken up, and so to be quite sleepy. And for a long time that was mixed in with the hypoxic type injuries, and all foals were treated the same way. Now I think we recognise that, and I don't know if you've come across the Madigan squeeze, probably a lot of people have at this stage, that those foals, if you go back and re-squeeze them, do it using ropes, you then re-establish that, it's almost like a rebirthing if you like, and you re-establish that normal hormonal transition, and those foals tend to often do quite well after that. So usually foals that aren't drinking, if there's no obvious broken ribs or no obvious injury, we'll usually try squeezing them to see if that works, and a lot of times it does. The other main reason that a foal will be born, a dummy foal, will be an actual hypoxic injury. Those foals don't tend to respond to the squeeze because they've had a cut off in blood flow during the foaling, and that can happen if the foal gets stuck in the pelvis maybe, and the foal's rib cage is up against the umbilical cord and they get a cut off of blood flow, or if there's some interruption during the foaling or some dystocia that causes it to be delayed, and so that foal has a shortage of oxygen. And those two conditions tend to present quite similarly, so it's not always easy to tell them apart, but those are your foals that don't drink, don't act normally, tend to be just very sleepy and dopey, or they might be a bit inclined to seizure and that kind of thing. That's a serious condition and usually requires sort of intensive veterinary intervention, particularly in the second case for those hypoxic injuries. So the other thing then to watch out for is sepsis. And sepsis can be quite difficult to tell apart from your dummy foals because they tend to present quite similarly. So foals can become septic in utero, in which case they're born with the infection, or they can become septic after birth or during the birth process from contamination, fecal contamination or whatever. So those foals tend to act the same way. They tend not to drink. They're often quite sleepy. The one thing that can help you differentiate sometimes when you look at those is they have really, really red membranes. So they'll tend to have a really red orangey tongue, really red gums. What can cause it, I suppose, is if mares already have a pre-existing condition or have placentitis, so the mare has some sort of infection. And as I said, if they don't get their colostrum and then become septic, or if they fall in a dirty environment, or dystocia where there's a lot of contamination, those foals need really aggressive veterinary treatment. They usually need to go on your sort of most important antibiotics that we save for those kind of cases, and often need fluids and oxygen and all sorts of things. And actually a lot of them end up needing intensive care, and so they can be quite difficult to treat. And then I suppose in the less serious side of things, retained meconium is quite common, particularly in colt foals. So you'll see them with their tail up trying to pass their meconium, and they tend to get very irritated with it. It's usually pretty straightforward to treat. We usually just treat them with enemas if they haven't already been done. Maybe some buscopan to cause a bit of gut relaxation, or a little bit of sedation for them to just stop panicking about it until they pass it. And then sometimes some fluids, because foals that are a bit dehydrated, all their mucous membranes in their gut can be a little bit dry. So normally retained meconium is fairly easy to treat, but usually you can, it's a lot of the times, prevent it yourselves by treating with an enema, particularly important in cold foals. But just be aware that probably 2 enemas is enough. If you give too many, the level of phosphate in enemas can be bad for foals. So usually if you haven't had any success after 2, I'd be probably inclined to call for veterinary help at that point. Then ruptured bladder, I suppose, is something everyone kind of worries about. Thankfully, it doesn't happen too often. Again, it's most predominantly cold foals. They tend not to show any signs until about 2 to 3 days after birth, when the abdomen is starting to fill up with urine. So for the first 24 or 48 hours, they usually seem pretty normal. Obviously, you won't see them pass urine, but then a lot of people don't tend to see foals pass urine anyway. So what happens with them is when the urine builds up in their abdomen, the abnormal electrolytes tend to make them sick, and that's often when people notice foals become quite dull, stop drinking, maybe become a little bit sleepy, and then at that point, when you get a vet to look at them, you'll maybe notice their abdomen's a bit swollen, and when they do a scan, they'll see that the bladder is ruptured. Nearly always they need a surgical intervention, and I suppose it's just something to be aware of, because if they get very sick and have, particularly if they present quite late on and have a lot of urine and a lot of electrolyte disturbance, they can be very difficult anesthetics because of the abnormal electrolytes. So the earlier you pick it up and the earlier they go in for surgery, the better the outcome for the foal. And then the last of my little list of horrible things to be watching out for is neonatal isoerythrolysis, or jaundice. So most often this occurs in foals from mares that have had several previous foals. It's very unusual for it to happen in a maiden mare. I'm just watching the time now. In a maiden mare, unless she's had a blood product or a blood transfusion herself, because the trigger for this is from a previous foaling. Some of the foal's blood mixing with the mare's blood, her producing antibodies to that type of blood, and then producing those in the next year's colostrum, and then the following foal absorbing that colostrum and then having its own red blood cells broken down. So it usually happens in mares that have had a number of foals. So the clinical signs with jaundice vary enormously, from being very mild, if they only have a sort of mild, low level of antibodies, to being very severe. But they can be, foals can often just be a little bit quieter. You might notice that they tend to blow a lot when they run around the stable because they don't have very good exercise tolerance. You might notice the membranes being a bit jaundiced. They might be a bit flat in themselves. It can come on quite suddenly, or it can come on quite slowly. And once you appreciate that a mare has had a foal with jaundice, then really after that her colostrum should be drawn off her and thrown away, and her foal given colostrum from another foal afterwards. But when you do diagnose it in a current foal, then usually the treatment, occasionally we'll have to do blood transfusion in the foal from the mare's own blood cells which have been washed, but a lot of times just normal fluid therapy to support them, keeping the foal quite quiet, and maybe other supportive treatment is enough. So you know, a lot of times the first year it happens, it can be reasonably mild, and you can treat it fairly successfully with your vet, and then know that this is an issue for your mare going forwards, and make a plan for following years. So I have a time to just quickly go through the mare. So it seems to be all about the foal, but there's obviously a few considerations for the mare as well. So in our practice, we normally do a routine postpartum check on most mares. So we go out to them in the first 24 to 48 hours after birth and do a quick check over. So we check their heart rate and hydration. Obviously, heart rate will give us an idea that they're not having a maybe a subtle or missed hemorrhage. That's the time for me, is it? Oh, sorry. So if they're hemorrhaging, their heart rate will tend to go up, or if they're dehydrated, they might be at risk of an impaction colic or something like that. So we check their cardiovascular status, check the vulva and vestibule to make sure too much damage hasn't been done, and if it has, make a plan to repair. And ideally, we check the placenta and make sure it's been fully passed. And this is a picture. Put this up every year, actually. This picture, but. That's a placenta laid out. You can see the tips of the two horns are fully intact. So that's how it should look. So the three main things to watch out for in mares would be in the first, I suppose, 24 hours of foaling would be postpartum hemorrhage. I think that's a biggie that everyone worries about. It can happen into the broad ligament, which is the area around the ovary. That usually is very painful, but is often compatible with life because the bleeding will be contained by the broad ligament. So those mares tend to be really colicky, really painful, but will usually survive. Then it can happen into the uterus or into the abdomen. So the ones in the uterus tend to have a fairly high survival rate as well, because eventually the uterus will contain the blood. The ones in the abdomen less so, because it's really just pouring into an abdomen that can accommodate a lot of blood. So there's not really, and anyhow, I'm not going to go into all the treatments because nobody really knows if any of them work. But generally, I suppose the ones that are easiest to treat are the broad ligament ones, where they are bleeding particularly into the abdomen. There's virtually nothing you can do other than keep the mare quiet, maybe keep her sedated, and hope and pray that it will stop by itself. Metritis then, I suppose, is one that can usually be prevented a lot of times. That's usually caused by either retained membranes that maybe people haven't appreciated that the mares have retained their membranes and left them too long, or maybe a very traumatic birth where there's been a lot of contamination, maybe a lot of hands in and out and a lot of pulling and dragging. So that tends to present 2 or 3 days after foaling. The mares will often go off their feed, get quite sick, get a fever, become quite depressed. So usually if you've had a difficult foaling, or if there's been any issue with your membranes not being passed in a good time, if you're proactive with those mares and flush them and maybe treat them proactively, you can often prevent metritis. But when it does happen, you need to be very aggressive with your treatment because they're at high risk for laminitis, mares that get metritis. So we usually use IV antibiotics, anti-inflammatories, oxytocin, and a lot of lavaging of the uterine fluids to clear that up. And then the last one is colic. Quite a number of mares can colic after foaling, just because when the foal comes out, there's a bit of a void in their abdomen, and the various parts of the gut can fall back incorrectly. So those post-foaling displacement colics tend to be a kind of low-grade mares, kind of not really eating, just a bit depressed, lying around a bit, but not actively colicking. So if you have a mare that's going on like that for a few days after foaling, I'd be sort of high suspicious for either an impaction because she hasn't drunk enough, or a displacement type colic. Then I suppose you can also get a ruptured viscus, which is any part of the gut from a foaling trauma. They tend to cause very severe colics where they're incredibly painful. Horses get very shocked, and they can actually happen before or after foaling because the foals can rupture those. Can rupture viscus while it's still in utero or in the process of foaling. So that's it. I've tried to rush through as fast as I can. I suppose if in doubt, call your vet. They'll always hopefully be there to at least answer a question if they can't attend immediately. And I think preparation and prevention is probably 90% of it with foaling mares.
Thank you very much, Andrea. I think it's always probably a very important topic. We have time now for a few questions as well. And if anyone online has any questions, they can raise their hand on their video and we'll be able to open up your mics, or you can pop it into the chat and we'll get to it. If we don't get to your question, or if you think of anything after today, you can always pop myself an email and I'll be able to pass it on to any of our speakers. So does anyone in room have a question or online?
I suppose we've one over here. I'll come over with the cube. Just hold it to your chest and you can speak into it.
Just a quick question on bedding for mares. Would you have a preference for sawdust or straw?
That's a really good question, actually. I would definitely recommend straw. Sawdust gets everywhere, absolutely everywhere. So a good deep bed of clean straw and as mucked out as often as possible in that really immediate post-foaling time, yeah. And it's warmer as well for foals and just much more comfortable.
Okay, thanks very much.
Yeah, no problem. Look, and as I said, if anyone thinks about anything after the event, we will. You can pass them on to myself through my email, and I'll pass them on to the speakers.
Okay, thank you.
Thank you very much, Andrea. So next we have Olive O'Connor, and she's going to talk about assisting during foaling. Olive is based out of Ballykeen Stud in County Wicklow, where she runs a foaling unit and boards mares there, breeds, and also consigns at the Irish and the UK sales. She is a graduate of the Irish National Stud course, and she also, after that, worked at the Irish National Stud in the foaling unit, got plenty of experience there, and then went on to gain more experience at bloodstock agencies in New Zealand and Australia and Kentucky, and then came back home and you set up your own business in 2008. So plenty of experience. I think you've done multiples of foaling, so we'll introduce you now to take it away.
Hi there. Well, I'm delighted Andrea covered a lot of what I was going to say, so if I overlap a bit, don't mind me. So I'll just go through the different stages of the foaling mare. The first thing, I suppose we all know, the mare is, it's 11 months gestation, and you can kind of plus or minus 10 days from that. So that's just, I always tell everybody, you can't take your eyes off the mare. That's the number one rule. And I suppose just expect the unexpected, because anything can happen. You think you're plain sailing, even with a mare that you foaled several years and everything's gone grand, you just never know what can happen. Well, Andre touched on that too. So just have your stable ready and well fed, your mare. And a lot of people like to rug mares, but that's fine, but you definitely need the rug off the mare about a month before she's due to foal. So hopefully she's coming in at night. I mean, she may not be, but I just think rugs are dangerous, because if they do decide to foal, you could have a bad accident with legs and the foal getting caught up in a rug. So you get your mare is coming in, then you have your stable ready and you're getting close to foaling. So in the last 2 weeks, you're sort of watching for the signs of especially the udder, the signs of the teeth starting to fill and it getting bigger. And just the vulva starts to relax as well. It'll get longer, and also sometimes I'm not great at watching it, but in some mares that you see all around the tail end, it starts to relax, and the croup of the tail is more prominent. So as you kind of get to know your mare, if you know her well or you don't know her, you kind of keep watching for all these signs all the time. So that's sort of just as she's coming up to foaling, and you have to really check I don't want to say a time frame. I have mares that come into me like a month before they're due to foal, and they'll be checked every 15 minutes at night or during the day. So you really, from a couple of weeks before their due date, you need to be just watching them all the time. They probably, when she's coming into at night, most mares foal at night time. They foal kind of between 8 in the evening and 2 in the morning. You will have the one that'll try and foal out in the field, and often if they have foaled before in the field, they'll try and do it again for some reason. They like to catch you out or catch everybody out, but most of them will foal in those hours of darkness that probably when they were in the wild, that the foal would be strong enough by dawn to gallop away from predators, so it would have been up and sucked and ready to go. So you're watching your mare, if you kind of know what her usual carry on is at night time, but she'll probably start walking the box, maybe sweat up a bit, getting uneasy, digging up the bed, all these signs, and then you'll suddenly probably notice she's getting into a labour stage, and she'll start to have contractions, and she might, pee a good few times or want to look like she wants to have a pee, and that's usually a sign that she's attempting to break water. So now then there's maiden mares might do it very, very quickly, and you might hardly see it because they don't know what's going on, so they could just suddenly break water, and you're at one end, or you're trying to watch them from out. You don't stand in the stable with the mare either, because you'll only upset them, so you try and watch from a camera or watch from outside the door somewhere. But they could catch you out and do it very, very quickly. And then some older mares that know their job really well, they'll just break water and get on with it, lie down, and no big fuss, sorry now. At that time then is your time when Andrea was saying, like, that you put on your bandage, you have your foaling kit there, and you put on a bandage, you wash down the mare, get her ready, and then if she breaks water, and normally the foal will dive out, the head on top of the two front legs, that's the correct way that they'll come out. So if you see that, you should be very happy. There's no need to go rooting around. You can put in your hand and feel, well, like you're hoping you're not going to feel another leg or anything like that. You just check that everything is, normal. And then, so you've established that, and she'll probably, if things are a little bit, one leg back or whatever, she might start getting up and down herself a lot and look like she's a bit colicky. And actually that's good if she's doing that, because if she's kind of sorting out the foal herself, so try not to panic. And then it should all happen within 10, 15 minutes, maybe 20 minutes. It depends on the mare. There's no sort of set time. Some do it very quickly, some take a bit longer. So you can sort of assist the foal coming out, and then don't rush to try and pull the foal from the mare. Just let it lie on the ground for a while and have its time. And then you probably need to break the cord, but you don't want to do that too quickly, the umbilical cord. So you can feel the pulse of the blood going through from the mare to the foal. And then when that's stopped, now some mares will jump up and the cord is broken and there's nothing you can do about it. But if they lie down and they're quite happy that they can the foal is in front of them and they're sort of licking the foal and everything is going fine, then you can break the cord, you can kind of twist it and pull but there's a knack to that. It's easy for me to say because I've done lots of them. You're kind of twisting the cord away and the stump of the cord, or else you can just cut it. And then that's your time then to put on the iodine. And if the mare is still lying down, it's an ideal time to tie up the afterbirth. Now I brought along a foaling kit and I can show anybody, the few different things, or even how to tie up an afterbirth. You can catch one end of it and tie it to the top and then tie the rest up, but I can show that to somebody afterwards if they're interested. And you've done then you can give a foal an enema. That's the way I go through it, and you can warm the enema, and then you're just putting in the enema under the foal's tail. If you be careful with a colt, because their passage is narrower, so you just if the top of the tube of the enema is about that long, you just go in about there and just gently squeeze it in, and within a couple of minutes you should see then the meconium passing out. And you're happy then when you see that. That's one less thing to worry about. And it might pass some more even a half an hour later, and it could pass more as well when the foal sucks, because colostrum is like a laxative as well, and it helps everything to push through. Then your next thing is the foal will start trying to get up, which is great. And try not to be like too much in the stable with the mare and foal, and be aware as well that some mares, you know, they mightn't want you there, and they could very easily just chase you out of the stable. So sometimes they just need that time with the foal themselves to bond, and they don't, you're kind of in the way of them and the foal. You want to do everything, but at the same time, you're better off to actually get out and just observe and let the foal try and get up itself. If it's struggling and it might have problems with contracted tendons or something like that, and you may have to help it, but sometimes they just need to be balanced. And if they're falling down all the time, you can just kind of balance them, stand behind their tail end and just hold them, and then they'll get their balance and get their confidence. And hopefully the mare will be agreeable, and that you won't, she'll let the foal go and suck. Now maidens you might need to hold them to let the foal suck, because they'll keep spinning around the foal. They don't know what's after happening. They're panicking about you and the foal. So you just have to, give them a chance, and it might take a bit longer. Yeah, that's kind of that end of it. I've got the foaling kit. I've just said you need a tail bandage. I always have a bucket of warm water as well, because as Andrea was saying, you need to keep everything clean. And yes, you have washed down the mare, that's fine, discard that water. But if you have a clean bucket there, if you've been helping the mare, you're able to just rinse your hands, because then if you're going to put iodine on the navel or tie up the afterbirth, your hands are going to be all dirty. You need a scissors as well, a sharp scissors, because if you have a red bag, which is the placenta coming first, and it looks like a kind of a red purpley, kind of got a kind of a velvety sheen off it, and that's coming. And like if you do touch it, that's fine, but you probably feel the foal's head and legs, but it's very thick and rubbery, and you wouldn't break it with your hands, so you'll need a scalpel or a sharp scissors to cut it. And if you see that, it's urgent to kind of get that done quickly, so have your scissors there. If you do see it, you probably wouldn't even have time to ring a vet to ask them about it. You just need to be brave and confident that you don't cut anything. Scissors probably better than a scalpel. And have gloves as well, plastic gloves. You might need, I always have pulling ropes, little ropes to put on around the, around the feet, just below the fetlock, between the fetlock and the hoof. So if you need to give the foal a bit of a pull, and you don't pull you just gently pull as the mare has a contraction. When she's given a push, you pull at the same time, and everything should go okay. And you can, when the foal is going to suck, that's a good time to kind of check the colostrum. You might, you're also checking that the mare's udder is clean. You could just draw off a little bit of milk. Now, lots of people have a gadget called a refractometer, and they check the quality of the colostrum. And on it, if you put a bit on the slide and you look through it, I have one there, I can show it to you. It'll tell you if it's poor or good, but you get used to actually knowing what the colostrum is like, because if it's lovely and sort of like honey, milky milk with honey going through it and really thick, it's usually top class. And then if it's watery and very kind of light or like pale milk, it's usually not good. There's something in my head there about when the foal is sucking. Oh yeah, sometimes you'd have a maiden mare and her bag mightn't look good, and she mightn't have really waxed that much. But actually, as the foal sucks, don't worry too much. You will most likely have your vet, to attend. But most mares, their milk does come on after a couple of hours, and by even 12 hours, they'd have a lovely bag of milk, and they might have had lovely colostrum. It's just way up there, and that she has small teats, and don't panic about that. Yeah, that's sort of it. I might have missed something. I mean, the main thing is that you're watching all the time. I mean, I said it at the start, say it at the end. I tell everybody, and I have really good night staff and staff that help me, but our motto is just observation is the name of the game. Don't take your eyes off them. Yet, don't panic if, you know, you have to kind of keep your cool and keep calm. And also foals in the first few hours, once they get into a rhythm, they more or less get up on the hour. You could nearly set your clock by them. They, you know, they get up and they're kind of, the first few times, like they're shaking their head and where am I? And then they go to the mare for a suck. They suck, they feel happy, they lie back down again and they have a lovely sleep. And they almost do it on the hour. If you're watching them, you could time it. And for the first couple of days, if that's happening, that's normal. And then as they get, you know, like once they're 12 or 24 hours, they get braver and they have a little play around the stable. And that's also when they get curious and they might, that you need your stable clean, as Andrea was saying, no droppings around, because they're curious and they'll mooch around everywhere. So, you know, and the same thing with walls, they could lick a wall or whatever. That's it, I think. We might have flown through it, but anyway, if anybody has any questions, I'd be happy to answer them.
I mean, thank you very much, Olive. It's picking up both mics. I think one of the, you know, stable staff are always being told to clean stables, and you're like, oh my God, why do I have to go with the stamp score brush again? But just hitting on those points, that foals are so curious, it's like, yeah, you really have to, and especially if their gut is open in those first few hours, then yeah, it may be a very tedious task to go around scrubbing walls, but it makes so much sense to keep that.
Yeah, at the start when you have getting your stable ready, and also make sure, you know, clean water for the mare and the feed pot, because if she doesn't drink, you know, and for some reason, sometimes you can actually over clean and people will be almost putting disinfectant on the water trough, but it can taint the water as well. So, and horses are funny, they get a taste of something, they won't drink, you know, water. So you just have to be careful that way as well and watch that the mare is drinking. Hydration for the mare and foal is very important.
Just getting back to the stable environment as well. There was a study done a good few years ago that found that the levels of our equi in stables were 17 times higher than out in the paddock. And I think people think they pick it up from gateways and paddocks, but they nearly always pick it up from the stable, and they nearly always pick it up in the first few days. It's a real slow burn, or equi, it's like TB. So a foal that picks that up in the first few days won't get sick maybe till they're 2 or 3 months, but that's when they pick it up, and they tend to get it from the mare's dung. Or from the walls like that, or equi can live in cobwebs on the walls. So that foaling box, having a clean foaling box is huge benefit to the foal.
Lots of clean straw.
One question down here.
Okay, I was just wondering, how often do you spray the navels in the first kind of 48 hours or the first couple of days?
Good question. And Andrea was saying about dipping it or spraying it, but you have a great option. When the foal is just born, you kind of have a bird's eye view of the navel usually, because you know, you pull over the leg and you look at the navel and you spray it. So that's good, you spray it directly on. We do them every day and check that the stump is starting to dry. So, you know, when the foal in the morning, when you're getting it ready to go out, just check the navel, but we spray them every day for about 5 days. And then when it's dry and all is good, yeah.
Olive, sorry, excuse me. I have 2 questions. Do you use plasma much, and is it for specific clients, or is just if they need it? And then secondly, in an emergency when it's going wrong, would you wait for the vet to come and sedate them, or do you just load up and go? And how far is your nearest hospital?
I'll go with the first question, the plasma. I'd have some clients that always want plasma for their foals, and we just have it arranged and a plan in place. It's not something, you know, it's expensive, and it's not something that we kind of decide for every foal, because, you know, all the costs add up. And if your foal is happily sucking and, you know, is acting normal and, you know, looks everything fine, I myself, I don't worry about it. Yes, it's another added thing. It's great. And if you want to do it, and if I decide for a couple of my own mares or some of the clients, that's fine. Andrea might be good to answer that question as well.
It's a funny one, plasma, isn't it? It was very popular a few years ago, and I think it's starting to lose popularity now. I think there's been a lot of, again, studies that have shown it, you know, it hasn't made a lot of difference on some farms. I think prevention is definitely better than plasma, because an awful lot of those infections that plasma is trying to deal with, you can prevent by good management and just having access to good colostrum. I mean, good colostrum is better than any plasma. But, you know, there are certain circumstances where you would use it. But routinely, our clients don't tend to. We probably normally use maybe 6 to 10 bags of plasma a year for their entire practice, you know. So it's certainly not common treatment anymore.
I mean, I foal up to 70 mares and probably use 2 or 3 maybe in the, you know. And it was a craze a few years ago, about 10 years ago, it was a big craze, and people were spending a fortune on it. I mean, I have a colostrum bank because I have to have it. So if you think that your colostrum or your vet thinks it's not good quality, you need to know where you might be able to get colostrum, you know. And then going back to your other question about calling the vet, well, that was another thing you should have in your foaling kit, the vet's number, and have your postcode as well, in case there's another vet on call or something the night you ring and your own vet is unavailable. So, you know, if your vet can get there quickly, if things aren't going in the time frame that I maybe have flown through it, but, you know, in the different stages, and the mare is going on for ages, or you can only feel one leg, or you've 2 legs and no head, just ring the vet straight away. Because, I mean, I'd often even have one that I think this could be difficult, I'd probably be okay, but I might just ring and say, could be in trouble here, you know. So, what did you ask me about loading up and going?
Yeah, no, I was just wondering, like, do you wait for the vet, like, to sedate them if they're trying to foal on the way, or do you just give them settling yourself and then travel?
No, I'd always wait for the vet. I'm lucky I have a vet very nearby, and they're there in minutes. And I mean, the other thing is, some people probably experience a foal in a mare on their own, or they might be used to cows or whatever, and that's brilliant. But it's always good to have somebody else on call as well to help you. And it's easy for me to say I have night people that are there, but I also have somebody else on call to me at all times, that if we need more muscle, or you have a very difficult mare that, you know, you might need 2 people to hold her, she's really panicking. And then the vet will decide. Usually my vet comes and says, look, better off to load up and go, you know. But 9 out of 10, we solve it ourselves there and then. Vets are very good, you know. I'm sure, Andrea, you're the same. You just can manage it.
My husband is a vet, so I know how to try and get him to go to the foals.
Yeah.
But actually, look, vets are always delighted if the mare is foaled when they get there.
Yeah.
It's brilliant, because if they haven't, it's usually big trouble.
Yeah.
Certainly, if we get called, we normally suggest to people not to keep trying to pull, because if the foal isn't coming, keeping pulling probably is not going to help the situation. So either to just try and walk away and just wait, or if the mare is very agitated, maybe take her out and walk her to keep
her
distracted.
Exactly.
But, you know, a lot of the times, if you leave them alone, they will sort it out. And
if they get up and down themselves a lot, you know. Sometimes you can kind of upset them if you're panicking. They sense it, they definitely do, and then they'll panic. So.
Okay, thank you. Thanks.
Just a quick thing to go back to the plasma. I just didn't mention that obviously you would use plasma if the IgG was low. So you can test the foal's blood, you know, sort of 12 to 24 hours after it's born. And if the IgG is low, then in that situation you would use plasma, because that will you get about 4 grams of IgG per bag of plasma, and a normal foal requires 8 grams per litre. So you can use 1 to 2 bags of plasma if needed, if the mare's run her colostrum, or the foal didn't get to drink on time or whatever.
Yeah.
Thanks.
Perfect. I think we have just one more question, and then we'll head over to next. It's designed to do that.
Yeah, they had a foal that needed plasma, say, last year because the IgG was low. Would that be repeated then? Is there much more likelihood in the future of that foal, of that mare producing a foal that needs plasma again?
Not necessarily. You know, I mean, they possibly do, but I suppose you're flagged up to do, you know, to just be, you know, you definitely check your colostrum and that your foal is doing okay. Get the vet to come in and examine it and check that everything is okay, you know, and then take it from there. I mean, if you want to cover all angles, maybe. That's why some people want to always give plasma, you know. It's not
a given once you've had it once.
It's not. You could have no problem the next year, you know. So what do you think, Andrea?
I suppose it depends why the IgG was low. So either the mare has run off her milk, maybe if her foaling was a difficult foaling or something like that, which wouldn't happen every year. Or, I mean, some mares will run milk some years and then won't do it the next year. So, I mean, if she's run milk and she's lost her colostrum and you haven't intervened and given another source of colostrum, then that wouldn't necessarily happen the next year. Some mares always have bad colostrum, but, you know, you can prepare for that. I mean, generally, we don't use much plasma for failure of passive transfer because most people are checking the colostrum, and if the colostrum isn't good enough, they're giving stored colostrum from another mare. And so if you're doing that, you generally don't need to use plasma. It's only when you get caught out that you need to use plasma. So the following year, if you're prepared for that eventuality and can get the colostrum, the foals need to drink colostrum within about the first 12 to 18 hours of life. So the gut wall starts to close as soon as they start to drink. So the sooner they drink, the sooner it closes. So a foal that drinks quickly, their gut wall will usually be closed by about, say, 12 hours. One that's a little bit slower. So you can, if you have colostrum, you can prepare and not have to use plasma.
Yeah, and that was another thing Andrea said about, you know, some people give the foals a bottle. I'm not a big fan of it. If they can get up and actually suck themselves, it really is the best. So just be patient. But if you have to, I like that, I'd say, even if you can get a small bit off the mare and give them a bottle, you know, grand, but a small little bit if you are worried. But because a lot of times they like the teat and then they don't want to go, they get lazy and they think, oh, the milk is going to come to them. So it's a fine line. It's hard to, but look, I brought a kit with me. If anybody wants to come up afterwards and ask me, and I can show you, I brought some plastic bags to try and make like a placenta and show you how to tie it up. So just feel free to ask me or even send Hannah an email if you want to ask anything else.
No problem. Thank you very much. All of that was brilliant. So we're going to take a quick 10-15 minute break now. So for everyone in the room, we have tea and coffee outside, and bathrooms are just on the right hand side as you go out. And for those online, we will be back shortly, about 10 or 15 minutes. Thanks, everyone. If everyone is ready, we'll jump into the second half of our workshop today. So I'm going to next welcome Lorraine from Connolly's Red Mills. She's been working with them since 2016 and covers thoroughbred stud farms, race horses, as well as elite sport horses. And she's going to talk about nutrition plans for mares, isn't it? And a little touch on foals probably as well. Come on up.
Hi everyone, it's great to be back here in person after doing a number of years online, so it's lovely to see everyone here today and thanks for coming out. So as Hannah said, I am starting off looking at nutrition for pregnant mares, lactating mares and foals. I suppose by comparison to the other speakers, I might have a little bit more to talk about because nutrition is going to have a big impact on the whole length of gestation and the foal that you end up with on the ground. So we're going to talk about nutrition to support fertility, nutrition for pregnant mares, nutrition for lactating mares, and early foal nutrition. If anyone has any questions, I'd be delighted to answer them at the end. So when we talk about nutrition, it's really important to think about the natural breeding season for mares. So mares are naturally bred or will naturally begin to cycle from May through to September, and that coincides with the height of the grass growth. So mares then, given that, will naturally start to foal from April onwards, and their maximum milk yield will occur when that peak, at that peak grass growth. So it's a raising plane of nutrition that's supporting the conception, it's supporting lactating mares, and it's supporting sound growth and development in foals. So considerations for the thoroughbred mare, we have of course advanced the thoroughbred season so that thoroughbreds are now being covered from February to June and then therefore foaling from January onwards. So we've completely shifted this around, not in line with the grazing season. So when we talk about nutrition for the brood mares, we're really looking at mimicking that natural plane of nutrition, which can actually be quite difficult to get right given that we're foaling mares down now in January, and when we look outside, there's not much grass out there and the weather is awful. So really what we have to think about is getting the calories right, the protein, enough antioxidants in the diet, and getting those key vitamin and minerals in at the correct time. This is a really nice study that was done in 2011 that confirms what we have always said. So we know that daylight hours dictate the timing of the breeding season. So we artificially advance this by putting mares under lights. But we also talk about the state of mares, the body condition of mares. And what this study did is it looked at a group of mares over 3 years, and it showed the red on the graph where you can see the red, that is a well-fed mare. The blue is variable, so it was trying to show mares that are in good condition when there is grazing and in poor condition in the winter time. So how a mare would naturally be. And then the green one is in low body condition. And what it showed is that when you have mares in good body condition, it's actually metabolic hormones that cause the first date of ovulation. So you can see the mares that are well fed have the shortest period of their off season, so when they're not cycling. And the mares that had restricted feeding had the longest period of time not cycling. So that went from, it was a massive 40 days for mares that were well fed all year round, compared to mares on restricted feeding that could stop cycling for 190 days. So really important to consider your body condition score all year round, and it confirms what we've always said, that lights plus an increased nutrient intake are required to advance the date of the first ovulation. So talking about body condition and fertility, underweight and overweight will negatively impact fertility. So mares that are underweight coming into the breeding season or are losing weight are more likely to suffer from irregular ovulation, reduced conception rates, and increased risk of early embryonic deaths. On the opposite end of the scale, overweight mares are more likely to suffer from a longer estrus cycle, reduced conception rate, an increased risk of abnormal follicle maturation, and insulin resistance. So oftentimes this isn't something that should massively concern us, but what I would be thinking about in these instances is mares that you know are insulin resistant. So mares with equine metabolic syndrome, that you're managing their weight well in advance of coming in for covering, and mares that are coming out of training. So maiden mares that have very low body fat stores. They would be the two instances where you'd be really focusing in on body condition. Protein is another really important part of nutrition when it comes to fertility. So we know that mares fed low dietary protein can fail to ovulate, and they're 5 times more likely to suffer from embryonic loss. That's massive. Again, if you have a mare that is being covered during the grazing season, the grass is going to be very high in quality proteins that are very digestible. And it kind of convinces the mare that it's right to hold on to the pregnancy along with the calories that grass gives. If you have a mare that's covered in February, their main source of protein is going to be their hard feed and their preserved forages. Preserved forages aren't very digestible when it comes to protein. So really you're wanting to make sure that whatever concentrate that you're giving, it has a high level of lysine, and you're looking ideally for soybean to be your first source of protein in that feed. So a good quality stud cube or mix fed at the correct rates will ensure the adequate protein intakes. And as a general guide, I'd always say to people, it's great if you go out and buy a really good stud cube or a stud mix, but if you're not feeding the recommended amounts of it, they're not going to get what they need. So if you're feeding less than a stub scoop, which is the round scoop with the black handle, if you're feeding less than 1 scoop of that in a day, I'd be advising to either change over completely to a stud balancer if they're in good body condition, or top it up with a stud balancer, because that's going to elevate your protein and amino acid intake. In terms of extra support, this is a question we often get asked, and usually it's really with problem mares that you'd be looking at additional support. So generally speaking, for mares that are being recovered or barren mares, a good quality stud cube along with a stud balancer, depending on feed rates, should have you well covered. But antioxidants can be quite useful as an extra support, because it has been shown to support fertility in a number of different species. So grass, again, if we go back to the natural breeding season, is a great source of antioxidants, but obviously there's a low availability in winter. So we want to try, if you're looking to support barren mares and early foaling mares, it can be useful. It's also proven to be very useful in older mares because their oxidative stress is higher and their egg quality can be reduced. So obviously the mare is born with a certain amount of eggs, and as they get older, that egg quality and the egg numbers start to reduce. So sometimes adding in additional antioxidants can be beneficial for those mares. So studies have proven that adding in omega-3 fatty acids, that could be in the form of carron oil or linseed oil, can be advantage to fertility, and also antioxidants such as vitamin E, selenium, and ubiquinol CoQ10. Vitamin E, selenium, very widely used along with lysine, and CoQ10 is, I suppose, a newer, more novel antioxidant that has lots of benefits proven in human nutrition and cattle, and now we're seeing more and more research coming out on the horse side. So talking then about the pregnant mare, so hopefully your fertility plans have all gone really well and the mare is now in foal. So early to mid-pregnancy, I tend to group together because there's not a whole lot happening. The foal is growing very slowly at this rate. So we're talking about months 1 to 8. And when we consider the thoroughbred mare, for the bulk of that, they're out on grass. So they're out on good grass. Generally speaking, their body condition will be good. So you're looking to feed to body condition, which is usually covered off with good grazing, but then making sure that you're thinking about your micronutrient intakes. So they're your key vitamins and minerals that are going to contribute to healthy growth and development of the foal. Your energy and protein requirements will begin to increase from maintenance from month 5. And they go very slowly in the first 1 to 8 months. And really your rapid growth and development is happening in the last 3 months. So nothing to worry about massively here, just really making sure that your key vitamins and minerals are being covered off. This is just an example of this, and it's something that I talk about quite a lot because in the summertime, mares are often out, whether they're barren or they have a foal at foot, and they look fantastic, as a lot of mares will, on good stud farms with good grazing. And you'll see at the top of the graph, the energy and the protein content are actually above the recommended intake. So the mare is thriving, doing great, and the green is showing that the requirement is being hit. But you can see there's a couple of vitamins and minerals there, iodine, copper, zinc, selenium, vitamin E, that might not always be hit just on grazing alone. So they're the ones, particularly in Ireland, we know the likes of copper can be very low, which I will show in a minute. So making sure that if you have a horse out on grazing, that you either use a salt block, a stud balancer, something that's not going to promote loads of calories, but you're making sure you're getting those key vitamins and minerals in. So this is compared to a pregnant mare on the same amount of grazing with Grow Care Balancer. So it's just a stud balancer going in. It's usually at kind of 500 grams a day, so about a coffee mug full. And that's going to basically bring up all of those deficiencies back into normal levels. Copper, as I mentioned, we know in Ireland, we don't at any time of the year when horses are on full grazing meet those minimum copper requirements. So it should always be supplemented in, whether that's using a stud balancer or a copper paste or mineral buckets. The problem with mineral buckets, I find though, is you can't, it's hard to know how much they're actually getting of it. At least if you're giving a syringe or a stud balancer, you know, okay, right, they're covered off, they're okay. So just to recap, feeding in early to mid-pregnancy, mares at this time are usually on grazing. They won't need much concentrate feed to provide calories. Use a good quality stud balancer as a broad spectrum support. If you're relying on pasture, it's good to know what it provides. So if you can soil test to really maximize your pasture's potential or analyze grass, that should be done every 2 to 3 years. And then a mineral block can be useful but difficult to measure, and supplementary copper can be useful if you have those known deficiencies. So late pregnancy, quite a lot of information on this, so do bear with me, but this is really where the most of the fetal growth is occurring. So you have 60% of fetal growth occurring in those last 3 months of gestation. Again, considering the time of year, thoroughbreds would often be stabled at this time. It's usually falling kind of from November to March. So there's little or no fresh grazing. So it's a really difficult time to manage nutritionally because it's a really demanding period. So your calorie requirements are increasing while you're trying to rely on preserved forage, and the appetite is naturally decreasing because the space in the mare is naturally becoming tight. So therefore they tend to reduce their appetite by about 20%. Your protein requirements are increasing and your forage is quite a poor source of protein. So making sure you get that through concentrate feed is going to be important. You're going to have an increased rate of nutrient transfer across the placenta. So that means what the mare is eating is going to pass through to the foal, and the foal is going to need to store a lot of those minerals in the liver for birth, for key minerals that aren't actually present in the milk. So it's really important that the mare's diet at this time is balanced. If it's not balanced, or if the mare doesn't have enough calories or enough protein, she will pull from her own reserves, but that means that the gestation period can be lengthened. So in terms of calories, they're increasing by 15 to 30%. Ideally, mares should be slightly fleshy, so we don't like to see mares with cresty necks or fat deposits, but we would like to see them kind of in a body condition of 3.5, because they tend to lose a little bit of condition then when they do fall down. At this time, you'd be looking particularly at older mares because they're generally going to have a reduced feed utilization. So what they're eating, they're basically not getting the most out of by comparison to a younger horse. And maiden mares, because their appetite can be a problem. So it's their first time carrying a foal. The size inside them is quite restricted. So getting them to eat enough to meet the calorie demands can be challenging. And even mares without a reduced appetite will only consume about 30 pounds of food in a day. So you want to make sure basically that what they're getting at that time is as highly digestible as possible. So small meals, frequently fed. If you're looking at a stud feed, you're looking for kind of a 14% protein feed to make sure you're meeting requirements. Generally speaking, you're feeding in around 6 kilos a day. So that's about 3 round scoops of nuts, about 4 scoops of a mix, because the mix is going to weigh a little bit lighter. And in to try and kind of bulk up the calorie density of the feed, you can look at adding oils for mares that are a little bit under condition or have pulled back on their appetite, because oil is going to be a dense source of calories, and look at feeds that are cooked. So by cooking the grains, you're maximising the digestibility again, so there's less waste basically being passed through the mare and out the other end. And if you can, provide a clean, soft hay, because that's going to have a better fibre digestibility. So late pregnancy in terms of protein, your protein requirements are increasing by 40% to support the growth and development. So there's a lot of kind of misconceptions about protein, but when we talk about protein, we're always talking about growth, repair, development. So an exercising horse is going to have slightly higher protein developments because they need to recover from that exercise afterwards. Similarly, a mare that's growing a foal or a foal on the ground, they're going to have higher protein demands to support that growth and development. If we don't have enough protein, we know it just slows everything down, and you're lengthening that gestation period again, which is going to have a knock-on effect when you go to cover them and you're a month later than you should be. So feed intake is limited, so you want to ensure the protein quality is high. Your hay, as I said, and haylage are typically not great sources of forage because they have very low protein digestibility. So you're looking to choose feed that's high in soybean because it's a rich source of lysine, which is a key amino acid for mares. And if the hay is poor quality, don't be afraid to supplement in with amino acids on top. Diets deficient in protein and lysine have reported to have higher fetal losses during pregnancy, lower birth weights, and reduced milk quality. So towards the end of pregnancy, you're also feeding to support that good colostrum quality. Late pregnancy in terms of micronutrients, there's a lot going on here. So your macronutrients such as calcium and phosphorus, they're going to double because that's supporting skeletal development. Trace mineral supplementation is going to be very important. Iron, zinc, copper, and manganese. What you put into the mare in the last 3 months of pregnancy, she will start transferring across to the foal to be stored in the foal's liver. And that foal will use those stores and pull from those stores in the first 3 months of life. So when we're talking about copper in particular, which we know is so important, copper, zinc, and manganese, to reduce the risks of OCDs, you would like to get it into your mare in the last 3 months. Trying to supplement it into the foal when they're born is a little bit more difficult. You'd like to have it there because that's the first 3 months the foal is going to be mainly reliant on the mare's milk, which will be deficient in those. Vitamins are very important. Foals are born without vitamin A stores, so they rely on vitamin A transfer from the colostrum. So ensuring your mare has enough in her diet will ensure it passes across to the foal. And deficiencies of these minerals can lead to reduced bone mineralization in the fetus, which is then potentially increasing the risk of developmental orthopedic diseases. So feeding in late pregnancy, in summary, you want small, digestible, cooked feeds and a soft hay alongside it. Typical stud cubes or mix are usually fed in around 6 kilos. Older mares, barren or maiden mares may benefit from a stud balancer. So again, you're just elevating that plane of nutrition. Antioxidant support has been shown to improve colostrum and milk quality. So you're looking for products that are containing vitamin E, selenium, CoQ10 or vitamin C, particularly if you have mares that have a history of poor colostrum quality. Lysine supplementation may be useful in mares, again, with a history of poor milk quality, and ensuring a good supply of trace elements such as copper and zinc will be important for the foal in early life. I know the colostrum was already talked about quite a lot, so I won't talk too much about this, but the mare's body condition and nutritional status will impact colostrum and milk quality. So again, I know I'm talking a lot about late pregnancy, but it is really key for the first few months of a foal's life. The udder will develop in the final month of pregnancy, and the immunoglobulins are concentrated in the last 2 weeks of gestation. Ideally, the mare would be in a foaling box at this time. It's not always possible, but if you can put her in the box that she's going to foal in, she's going to be able to build immunity to any bugs or germs that are in the box, and they're going to be built up to pass on to the foal. So ideally 2 weeks before. Deficiencies in late pregnancy can impact colostrum volume and quality. Vitamin E has been shown to support it, And more recently, there's been a lot of studies on yeast supplementation. So a live yeast as a probiotic has been shown if you're supplementing it from day 300 in the pregnancy to improve the IgG concentration in colostrum. So you're therefore supporting the passive transfer of immunity to the foal. Early lactation is the most demanding time nutritionally for a mare. The calorie requirements are similar to a racehorse in full training, so really massive. And we're asking quite a lot of the thoroughbred mare. So we're asking her to foal down, to produce good quality colostrum, to start producing milk, and to also successfully rebreed. What we often see is if you don't have good enough nutrition in early lactation, you can have more poor milk production, but often what can happen is you go off balance in the amount of calories being consumed and the amount of calories going out. So a mare who could be a very good milker and the foal is thriving, if she's not getting enough calories in, she starts to go into a negative energy balance. And that actually makes it very difficult to get them back in foal. Sometimes they'll stop cycling, they'll shut down and do nothing. So getting them kind of back on track is going to be really important. So it's a really important time to make sure that, you know, the calories going in are matching the calories going out. Milk production is massive and it's peaking at 3 months post-foaling. So it's a time of lots of energy use, so a lot of calorie use, and a falling plane of nutrition can hamper your successful rebreeding. So in terms of protein and micronutrient requirements, you're looking for adequate protein intakes because they've been shown to that reduced protein levels. If you don't have enough protein, you're going to reduce the protein levels in milk, and that's going to reduce your growth rate. So again, protein is always going to refer back to growth and development. So if there's not enough going into the mare, it's not going to go into the milk, and then you're going to slow the growth of your foal down. Vitamin and mineral requirements are going to increase for your mare by 25% from the late pregnancy requirements. So it's really massive what we're asking the mare to do. So we have to make sure we're putting in the right ingredients as such. So attention should be given to calcium, phosphorus, iron, manganese, and vitamin A. A calcium deficiency in the mare is going to reduce milk production and then cause bone demineralization. So really important to get that right as well. So in terms of feeding, it can be difficult to meet the protein and calorie requirements in early foaling mares, which can result in difficulty rebreeding. Generally speaking, if you have a mare kind of foaling late March, April, into May, it's quite straightforward because they'll be out on grass and your grass is going to have that quality protein and lysine in particular. But working with stud farms and doing a lot of diet plans, what I find is the mares that are foaling in January, February, it can be really difficult to get enough calories into them safely. Because you're relying on hay, which doesn't have a good protein digestibility. And then if you increase your feed too much, you're going to run the risk of, you know, over consumption of starches and increased risks of colics and things like that. So you have to be really careful if you have those mares foaling down in January, February, that you're feeding small amounts of highly digestible feeds. I know it's not ideal for everyone, but you know, that's the pressure we're putting on ourselves by moving the breeding season forward. If you can do 3 or 4 small meals, it's going to be a lot safer for the mare. It's going to reduce her risk of colic, and it's also going to make the feed more digestible when it's fed in small amounts. So small digestible feeds. If you're finding the mare is struggling with weight, if you feel like she's shrunk and shriveled a little bit a few weeks after foaling, adding in Caron oil or linseed oil, again, is going to bulk up the nutrient density or the calorie density. Make sure you have a clean, soft hay. One thing I haven't mentioned here is getting your hay tested, not only for nutrition, but also for hygiene. So mares that are getting loads of clean, soft hay is lovely, but if it's contaminated with anything like molds, yeast, or aspergillus, it's going to reduce the digestibility and the health of the mare. Grow Care Balancer, a stud balancer fed at a lower rate in on top of your stud feed can be really useful because it's just going to bulk up that nutrient density again of what they're eating. And supplementing calcium if needed, if you feel the mare is a little bit behind, can help again with the milk production. So early foal nutrition, foals are born with an energy reserve that lasts about 2 to 3 hours postpartum. So it's a small window, as as has already been mentioned, for the IgG transfer. But really, you'd like to see your foal within those 2 to 3 hours upstanding nursing. We'd always advise to use a refractometer to measure colostrum quality. Frequent nursing is really normal, so you could see foals getting up 4 to 7 times in an hour. Normal nursing behaviour in the first few hours of life, and then the first few days, is for them to get up, nurse, be content, lie down and sleep. It's a question we get asked quite a lot, because sometimes when you sit and watch a foal, it's amazing to see just how many times they get up and nurse in an hour. But it is normal if you feel the mare's getting agitated, if she's kicking at the foal, or if you feel the foal is nuzzling and really not getting anything and is not content and not settled after it nurses. At that point, you might be worried about milk production. But generally speaking, as Oliver said, some mares look like they don't have a huge amount of milk, but will do a foal really well. So really, you're just looking for that normal behaviour, that they're up, they nurse, they sleep, and then they're up again. But don't worry if they're up frequently in the first few hours of life. It's quite normal. Newborn milk volume consumed per hour is about 450 mils. So in the first 24-hour period, they'll have consumed in around 8 litres, and by day 2, it's up to 12 litres. So it's quite an awful lot of milk for a mare to produce. So it's really important that you keep an eye that the mare has clean, fresh drinking water at all times. At birth, foals are designed to digest milk, so they're very good at digesting carbohydrates. You'll often see a foal picking at the mare's feed once they're a few days old. It's nothing to worry about. The hindgut will then develop slowly over the following weeks, and the hindgut is where the fibre is digested. So your microbiome will begin to populate, and the foal will become more efficient at digesting fibre. So I would always say feed the mare to support the foal. Mare's milk and mineral stores will provide everything they need up to 3 months old. So making sure you're feeding the mare correctly will in turn make sure your foal is developing as you would like them to. It's normal to see the foal eating with the mare from about 1 week old. And supplementary vitamins and prebiotics such as Friscofol might be useful if you have a foal that's been born a little bit weak or backward, or a foal that's been recovering from an illness. Another kind of supplement to have on hand, it would be a clay-based product to bind extra water if they have scour, and electrolytes if they've been sick. So in summary, for conception, barren mares and mares being rebred should be on a raising plane of nutrition, so gaining weight rather than losing it. Antioxidants and omega-3 oils can help to support fertility. In early pregnancy, there's not a huge amount going on. You're just looking to maintain their condition and ensure they're getting enough vitamins and minerals in on top of their grazing. In late pregnancy, it becomes a lot more demanding. You're feeding mares calorie-dense meals, high in micronutrients, in particular calcium, phosphorus, iron, copper, zinc, and the vitamins A, D, and E. And then for lactation, you want to make sure you're meeting the demands for calories, proteins, vitamins, and minerals, particularly in those early foaling mares. So I know that was probably a lot to take in, but hopefully you've found some parts of it useful. And if anyone has any questions, I'd be delighted to take them.
Thank you very much, Lorraine. I know nutrition is probably such a minefield that you could probably go in for it for an entire day. Are there any questions in room or online? I suppose one idea, I mean, you mentioned there for your foal that it's not unusual to start seeing them eat with the mare, but if you're then thinking about as they go that little bit further, what could you then start giving the foal to maybe make up a nutrition plan for them, or?
Yeah, no, it's a great question and one we get asked a lot. As I said, the mare should cover the nutritional needs for the first 3 months, but it's really normal to see your foal nibbling away. The stud cubes and the stud mix are always safe for the foal to eat. You shouldn't be worried about it. You don't have to restrict it. But it can be useful to get your foal onto a creep feed. So ideally from about 3 months, you're looking, as the milk production is reducing, to start introducing a creep feed. Now, you can feed a stud cube or a stud mix. Ideally, you'd feed it separate to the mare, so the foal starts to learn to eat independently of the mare, and it's good preparation for weaning. It's going to reduce the stress levels when that comes around. Or you can feed them separately. So you can feed your foal a small amount of foal and yearling mix or foal pellets in a separate container. there's nice containers that you can get if foals are out in the field, that you just hook it onto the paling, and it only allows space for the foals' little nose to get in and not the mares, and the foals can come and go from that as they please. Or you can feed it in two separate, with the mare tied up in one corner eating her feed and the foal eating separately his own feed. It's really a preference. What I would say with foals is a steady growth curve is what's most important, and it's what's going to reduce a lot of the risks in terms of your developmental diseases. So making sure they're not getting too heavy too quick. If you find they're eating with the mare and they are getting too heavy, it's best to restrict them and to put them on a nutrient-dense, smaller amount of feed and feed them separately.
I think we also then have one question online.
Hi, can you hear me?
Yeah, just a little louder.
Oh, sorry.
Yeah.
James O'Toole, just wondering about the stud cubes, and you're feeding stud cubes, and then you're suggesting a top-up feed with the Grow Care balancer. But with the stud cubes being fully balanced feed, then is the balancer addition going to upset the balance of nutrition in the feed, or does it complement each other?
No, that's a great question. Generally speaking, your stud cube will cover all of the nutrient needs of the mare, providing it's being fed at the correct rates. So as I said, typically we would find in the winter time for a thoroughbred mare foaling, when there's not much grass, you're feeding in around 6 kilos a day, which is about 3 round stub scoops. And that will certainly cover off all the nutritional needs. Where the Grow Care balancer can come in handy is if that mare is getting towards the end of her pregnancy and you feel she's not eating that amount of feed because her appetite is restricted, cutting out a little bit of the stud cubes and putting in the Grow Care is going to increase the vitamins, minerals, protein in her diet. And as I said, older mares and maiden mares, which may be struggling a little bit, they could benefit from the Grow Care as well. They will complement each other. There's lots of other good stud feeds and balancers out there that I think would be similar. You could feed one on top of the other, but you wouldn't be feeding the full rate of the balancer. So if you were feeding the balancer by itself, you'd be feeding about 200 grams per 100 kilos body weight. If you're feeding it as a top up, you'd reduce it to 100 grams per 100 kilos body weight.
Very good, thanks for that. And another question as well, in terms of copper, are you better feeding a balancer over a period of time as opposed to giving the copper syringes at different spots throughout the year?
Yeah, look, a balancer ensures that they're getting it daily. Copper is a little bit different to some of the other minerals. Electrolytes, for example, if you give a huge amount of electrolytes in one day, they'll just take what they need and excrete the rest. Copper is stored in the liver, and it's very difficult to know without, the mare dying and looking at the liver what the copper stores are like. So it really can be a convenience. I find in the summertime, it can be difficult to get the mares to eat a stud balancer because they've loads of grass. They're not interested in coming up to the feed pots if they're living out full time. And with the copper syringes, you can go out, you only have to do it once a week or once every other week, and they're getting it. But with with any stud balancer, they're going to have a full range of vitamins and minerals. So I think there's advantages and disadvantages to both.
Okay, thanks very much.
That's great. Thank you very much, Lorraine. So we will move on with our final speaker. Micheál Orlandi is from Starfield Stud in Westmeath. He stands exciting flat and national hunt stallions, far above Curcio, Smooth Daddy, Galileo Chrome, and as well as the stud side, once the covering season is over, Micheál switches focus to the agency side and works around kind of the sales and the yearling sales as well. So Micheál is going to talk about mating plans with us.
Firstly, apologies, I've no impressive slideshow for you, so it's just me and you guys. Hopefully that's someone important. Firstly, when Hannah asked me to do this, it's just a general gist about getting your mare back in foal and selecting a stallion. which we all like to think about and spend a bit of time over. So before we select a stallion, my suggestion to all of you is a very basic one. Do you cover your mare in 2023? And your options are to obviously cover her, another option is potentially to sell her, or your third option is to retire her and not cover her, or maybe give her a break, a year off. And that sounds a peculiar question or something to say from someone who stands stallions. I should be recommending you to cover your mare, but I do suggest to people, give it plenty of thought. Not just because you have a mare or you have a few brood mares doesn't mean you should cover them. And reflect on your mare and decide, is she worth covering, and how do you reflect on her and how do you make that decision, is she worth covering? Firstly, you can go through what some of the ladies suggested earlier on. Are easy to foal? Do they raise a foal okay? Like, for example, are the straightforward mare, are they very difficult? Do you have to foster out the foal every year because they don't accept the foal? So you have all them kind of character traits about a mare that you might say, do you know what, she's a bit of a T-Rex, and she's not we're having around the place. And then you maybe look at her performance as a brood mare. Does she go in foal? Is she difficult to get in foal? Is she costing a lot of veterinary costs to get back in foal? And then finally, then I suppose, is the black and white of it. Is she producing foals that the market wants to potentially purchase from you? And also, more importantly, do they succeed on the racetrack? Are they winning races? Is the mare producing winners? And most of us, and me included, we always think we're always very biased. We always think our mares, we're kind of looking at them with rose-tinted glasses. We think our mares are fantastic. And this is the mare that's going to breed us, group winner, so on and so forth. It's very hard to reflect and make the decision. Well, maybe no. When we sit down and co-light today, this mare is a lost leader. She's after having 4 or 5 foals. Her first 3 runners aren't winners. And maybe she's better off being retired, selling, or maybe just taking a break and not covering her for a year or two and seeing what the next couple of foals and yearlings might do in the racetrack. So that's the first thing I would suggest everyone do when you go home tonight, is before you start looking at stallion books, and you have the ITM stallion trail this weekend, said, well, will we cover this mare this year or these mares in general? When you make up your mind, the ladies have went in huge detail regarding foaling mares and what to look out for and so on and so forth. I'm not going to go into that. I'll just go to kind of the couple of requirements involved that you would need when you're going to a stud farm with your mare. To start off with, most stud farms, we look for an EVA, EIA, some will look for a clitoral swab. That can be done in advance of actually the cover itself, so get ahead of yourself. You have a lot of mares to cover and so on and so forth. Some farms will look for vaccinations. You should probably give your mare a flu and tet and EHV. One thing that wasn't touched on that I'd be a big fan of is giving your mare a rotavirus vaccine in month 8, 9 and 10, I believe. Rotavirus is becoming a bit more prevalent, I think. The ladies might know a bit more. For example, all the foals are out down a lot of foals, but there is kind of a train of thought, maybe there's a new strain of rotavirus, that they call it kind of Kentucky rotaviruses, came from America, and then you might be having to provide your plasma and so on and so forth, so you can get a sick foal. So it is expensive, but you can give your foal or your mare a vaccination on 8, 9 and 10. Now that's kind of irrelevant to actually covering your mare, but it does help prevent your foal getting rotavirus, so on and so forth. It is expensive. Don't quote me, but it's probably maybe around nearly €100 a vaccine, But in the grand scheme of things, from buying your plasma, having a very sick foal, a foal maybe going to an equine hospital, it's nothing in the grand scheme, especially if you're going to spend a couple of €1,000 in a nomination fee. So then we're going to barren mares, maiden mares. I think Lorraine touched on it, and maybe Olive as well, what you should feed them. I won't go into what you should feed them, but if I have a barren mare and maiden mare, I would have them under lights from the start of November, probably after the yearling sales, from start of November onwards. And the lights are on a timer system from 6 a.m. to 10 p.m. They're rugged up. I specifically put them on a walker. You don't have to, you can just turn them out during the day, but don't have them just standing in all day long, As Lorraine touched on, light is very important, daylight hours. So you're trying to, catch them out and let them think that this is the month of March or April, that it should be coming to the season. And I find the walker very good for maybe older mares that might have flu and so on and so forth, but it keeps them active, it gets them moving, and in general, most people mightn't have a walker, so at least turn them out, and even if it's a bad day, even if it's just a mucky field, get them out, get them rolling around, get them moving around, it's very important. So that's barren mares and maiden mares. Then post-foaling, what happens post-foaling? Well, I won't go into what Andrea did, but for example, you have your foaling heat, which is roughly day 7 to day 12. Some people might suggest to covering the foaling heat. As a person that stands stallions, I can highly recommend, please don't do it. It's very unsuccessful. For every 4 mares that get covered in a foaling heat, 2 might go in foal, and only out of them 2, only 1 might hold a foal to full gestation. So of the 2 of them, you're going to lose one of them at some point along the way. I don't recommend it. And you know, people panic late in the year, saying, "Oh, we'll cover in a foaling heat, she's clean behind," and the vet suggests this, vet suggests that. But statistically, from my experience, it's, you know, you're down to really 1 in 4 chance in the mare actually going to foal and holding the foal for full gestation and staying in foal. When the mare foals and the foal heat comes, I normally scan them, and well, I don't personally scan them, but my vet scans them on day 9, and that gives a handle on if they have ovulated for the foal heat and so on and so forth. In general, the mare will cycle on day 28 from when she foals, and that's when you can cover her again. And that's kind of, you know, the basic scenario of a cycle. Now, if you're doing that, I would say, well, don't wait for day 26 or 27 to scan them, and then ring, you know, the stud on day 27, say, my mare needs to be covered tomorrow. You want to be prepared, you want to get yourself organised. I would also suggest scan them at least on day 24, 25 the latest. Some mares might cycle before 28, and some might go on to day 30, 31, 32, 33. It depends. It also depends on the time of year. Sometimes, you know, some people say they cycle quicker when the sun is shining. We're in the month of May, and sometimes the cycle a bit slower. And we might see this time of year when mares are foaling in January, February times, mares do shut down because it's not natural for them to have a foal and to be cycling and going in foal. Something I do a lot of, I don't say you should do it, is that I PG my mares. And I give them 1.5 mil of a PG on day 18. Now, I don't give it blind. My vet will scan them with the foal heat cover. And then on day 18, we'll scan them again to see what they're doing, what size, what's happening. We give them a PG at 1 point on day 18. We scan them 3 days later after day 18. So that brings us to day 21. And normally they're for cover 6 to 7 days from day 18. So if we said 6 days from day 18, that brings us to day 24. So you're speeding up the normal cycle of the 28 days, and you're getting a few days. You don't have to do it. The reason I do it is that we would have a number of mares, and we would try and to kind of cycle them as best we can, as soon as we can, to get them back in foal. But it's just something that you can discuss with your vet. There's no need to do it. It obviously depends on the size of the follicle, but it's something that I learned, and I will admit where I learned it from my neighbours in Tally-Ho. We have the same vet. And now they PG'd them blind, apparently. I would still scan them here before I PG'd them. So that's just something if you want to gain a couple of days instead of your traditional 28-day cycle. Obviously, when a mare is covered, you scan them 2 days post-ovulation to make sure they have ovulated. Again, you might say, well, that's a cost, getting my vet back out just to scan one mare, have a call-out fee and all this. But, you know, you could be very disappointed when you scan your mare and 16 days later or so on and so forth, and she's not in foal. But for all you know, she might have ovulated on the second day or the first or second day, and you could have cross-covered her on day 3 or so on and so forth. And also, if you don't check them for ovulation, you check them on day 16 and they're not in foal, you kind of missed your numbers of counting them up and working out when they might be cycling again is all a bit skew ways. Obviously, there's a cost in getting your vet out, and them costs are only going up. But there is benefits, you know. Certain people might ring me and say, "No, I didn't call the vet. Sure, she's out of season. I know it, you know." Or she didn't tease to the teasers, you know. But she still mightn't tease to the teaser and still might have ovulated, you know. So then we go and we scan them normally in day 16, and you're hoping to see a little black dot. And you're going, yippee, happy days, the mare's in foal, super. If your mare's on a foal, don't worry. It's statistically, again, people presume mares just go in foal. They don't. And you presume stallions just cover a mare and they go in foal. I look across this, we have a little diary there for all the covers for all the different stallions. And there'll be variations in the stallions. But in general, if I counted up 10 mares, and they could come from all of you, different vets, different mares, different environments, roughly, I'm averaging 7 of 10 mares going foal. 7 of 10 mares go in foal. Now, they may come in different cycles. We might have a run that every mare goes in foal for 20, 25 mares. Then we have a lull, and a couple of mares don't go in foal. And I can break it up per stallion, or I can break it up for mixing all the stallions, which is flat and one national stallion I have. So, but in general, I would say, 70, 75% of mares going foal. And the reason they don't go on foal, as some of you will know, will vary massively. It could be in the mare, carrying a bit of fluid, she might have an infection, who knows what. It could be down to the stallion. There's variation of reasons, but don't panic if your mare doesn't go on foal. Don't expect it that you brought a mare to a stud farm, you got her covered, she should be in foal. As I said to you, I'm looking at a blanket of stallions and a blanket of mares. There's no correlation with the mare owners and where they come from. I would say, you know, averagely mares, we only get 7 of every 10 covers, you know. And also, later in the year, mares have a better chance of going on foal. Because as it was discussed earlier, we shouldn't be covering them now in the month of February and March, really. And they know that. Nature tells them that. And as time progresses, your mare has a better chance of going on foal in the month of April and then definitely the month of May. So don't panic if your mare hasn't gone on foal for 1 or 2 cycles. She might be perfectly clean inside and your vet's saying, well, look, I set her up, we checked for ovulation. Maybe you even give her a hormone after she got covered to make sure she ovulated out. And sure, the stallion man or the stud farmer rang, they said the stallion is really fertile. It can just happen that way, that the mare just doesn't take for 2 or 3 covers. How many covers would you go until the mare does take? It's debatable. Some mares for different years nature will tell them not to go on foal and just don't click. You try different stallions and it mightn't just click and go on foal. In general, I say within 3 covers, maybe 4, your mare should go on foal. If they're not, she might just need a year off, or she might need a bit more veterinary intervention to go on foal. So don't panic. So if she's in foal on day 16, we normally scan. You can scan on day 28, as far as I know, to see if there's a heartbeat from day 30 to 34. I waited till day 32 just to make sure you can see the heartbeat and everything's kosher. So it's day 16, they're in foal, day 32 heartbeat. Then we scan them normally on day 45. If a mare loses a pregnancy normally after that point, it's really they'll cycle again and go back and foal. I could be wrong, but I think it's these ladies are experts, by the way, you know. I'm just cutting you here. But in general, from day 45 onwards, they lose a pregnancy, they probably won't cycle again, won't go on foal. I normally scan them again between day 55 and day 70. And normally at that point, if I'm in declare, we're in declare, the mare's in foal, I kind of forget about her, you know, I presume she's in foal. Now, for some of you might want to scan them again because it comes to paying a nomination and you want to make sure when you get your invoice that this mare's in foal, so definitely scan them again. You know, I wouldn't put you off scanning a mare, you know, like, you know, you want to be sure that everything's kosher, you know, and we probably don't do that because in general, most of my mares are covered in-house. So next we go to the most, I suppose, interesting part of it all. Stallion selection, I should say. And how do you select a stallion? Again, it's not overly complicated. I normally start off with budget. How much money can you afford to spend on your mare? And give that plenty of thought, again, because you might see a stallion that you would love to use and you were at the racetrack when you won, you were up at the Curragh when you won the Guineas, or you're an Ascot when you're top hat and you saw him win the Coventry. And you said, I want to breed to him, you know. But give it plenty of thought and decide on budget, because you want to be doing this in a capacity that you're not under pressure, that you're not panicking if you have a little chestnut filly foal going, oh my, what we're going to do, you know, hope for a co-foal, because the co-foal is going to pay for everything, and you know what I mean? So please give it plenty of mature thought. When it comes, your other option outside of paying for a nomination is you can foal share, which some of you will know how that works. And a foal share is you would approach the stud farm and say, look, I have this lovely mare, I would love to use your stallion A here, and however, it's a bit about my price range, for example, maybe. Would you consider a foal share? And they might say yeah or nay. And how a foal share works is they would offer you the nomination, and you would put your mare in, you would get your mare covered, and you would pay no nomination fee, but in general, you will carry all the cost of keeping the mare, foaling the mare. It can vary per stud farm, but I would suggest, presume you're carrying all the costs, okay? And then you carry all the costs to the time the foal is born, you rear your foal, you put your foal in the sale, and then you would sell your foal at public auction. And 50% of the proceeds would normally go to the stud farm that provided nomination. So in short, that's how a foal share works. Do I recommend them? Obviously, if you have an opportunity to maybe get a mare and foal to see the stars, and you know you don't have 100 whatever, he has 75 talents sitting around, and the mare's of that caliber that she's worked to be bred to see the stars and she gets accepted, I recommend it. When you go down the pecking order, would I suggest it? you know, at anything less than probably 20,000. I wouldn't. I think in an ideal world, if you can afford to pay your nomination, then you can make all the decisions in that process of rearing that foal, whether you want to sell as a foal, whether you want to keep it as a yearling, whether you want to race it, whatever you want to do. When you're tied in a foal share, you know, your hands are kind of tied in your choices and what you can do with the resulting offspring. And that even comes down to the reserve on the day when it's selling, you know. And remember, you're carrying all the costs, and the costs are only going up. And some people would know about mare shares. A mare shares, if you have a mare, you might approach another stud farm and say, look, this is a mare, I want to get her covered, my plan is selling her. And can I do a mare share where we sell her in foal? And therefore they would agree to that. So you get the mare covered, and the mare will be sold in the late autumn, winter time, say November sales, and she'll be sold in foal to the stallion belonging to the stud farm. And again, 50% of the proceeds will go to the stud farm. It's not overly common, but it does happen. So just make you aware of that. If you're thinking, look, do you know what, we might cull this mare, an option of culling her is maybe selling her in foal, you know. And then when it comes to doing your matings, obviously everyone in this room wants to breed a superstar, a Group 1 winner or a Grade 1 winner. You know, you're all here to breed successfully. But in short, we all have to think commercially, because we all have bills to pay, whether it's the vet, it's the feed and red mills, or, you know, the stud farm for nomination. So you have to probably put your commercial cap on and say, well, look, how much, I remember that hearse winning the Coventry or winning the Curragh, what's the best stallion selection for my mare to make a commercial decision where if I breed to the specific stallion, the resulting offspring will have demand in the marketplace, i.e. there's someone out there, or more than one person, willing to buy it either foal or as a yearling. And by doing that, you have a better chance of breeding a racehorse. And you're saying, well, that makes no sense, Micheál. You're thinking commercially. But if you can breed a commercial foal or yearling that goes to the marketplace and wants to be, you know, people out there want to buy it off you, it will go into the system that is likely to be put in training. Someone will pay a training fee for it, and it'll hit the race course. So in short, I would say if you breed commercially, you have a better chance of breeding an animal that will go into the system and be successful and be that superstar racehorse you want to breed. Sometimes people might say, well, look, I have a grow for this specific stallion, and this cross and that cross, and you go 5 generations back, it's the Beverly Turk line, whatever it is, I'm going to breed a racehorse here. But that animal may never go into the system to have an opportunity to be trained to become a racehorse unless you're willing to pay all them costs yourself and put in the training yourself, which you're more than welcome to do. So by breeding commercially isn't, to some degree, probably the best way of breeding successfully. When you're making your commercial plan, some people think, well, I'm a foal seller or more of a yearling seller. I have the facilities to keep it as a yearling, and I do well selling yearlings. Some people say, well, look, I don't have the facilities, I'm short on land, everything out the door is a foal. And then you would factor that into your commercial decision. And as we all know, it's very common, and it's you know, as long as you know, it is the rule of thumb that first season stallions sell well as foals. It doesn't always transfer as yearlings, but people always are going around, whether it's in Golf or Tattersalls Ireland, to open the doors of first season stallions. Even if they're not planning on buying that Pacific foal, they love seeing what a group of foals look like by a first season stallion, and they make a judgment call then, geez, I like this stallion, or I didn't see any of them I liked, or did you see such a stallion, he's a couple of nice foals there. So you can take it that using a first season stallion commercially will get the door open, you know. And when it comes to selling yearlings, first season still carries sway, but you're not selling now to a foal buyer, you're selling normally to an end user. So your market changes slightly. Normally we are selling a foal. The majority of foals, I would say probably 80% of foals that are sold at public auction are bought to be resold as yearlings. So they're bought by people that are described as pinhookers. They buy a foal to resell as a yearling. When you're only 20% probably are bought to be retained to race, and they're normally high-end foals. People going in there to buy a Pacific well-bred filly or a real high-end colt that they're going to keep and race on. And I presume most of us, we won't be selling that type of foal how much we want to, but we will someday. We will someday. Then when it comes to yearling selling, if you decide to retain your foal as a yearling, you then have many more decisions to make. What sale are you going to go for? what sale could your foal potentially, or your resulting yearly get into, and who are the potential buyers for it. And the buyer bench changes because now you have people that want to buy a racehorse, an end user, someone that's going to put it in training. You also have breeze up people that will buy it to go breeze up consignors. But in general, I would say what sells well as a foal doesn't always sell well as a yearling. And we can see from pinhooking results that only a small percentage of pinhooks work. Now, they work successfully well, but a lot of people lose money on pinhooks, you know. If it was easy, it would be all pinhook and foals. So at times when you're making your mating plan, do consider when you're sitting down, going through your stallion book, you know, are we breeding this to sell as a foal, or do we have the option to breed as a yearling? If you do, it does change and should skew your mating plans. Also then, I would highly recommend, not just because of a stud farm, please visit as many stud farms as you can. Please don't go by a picture, an advertisement, or in a stallion book. Go and look at the stallion. Spend as long as you want looking at them stallions. And even if you saw a stallion the year before, when he came off the racetrack, go back and look at them the following year, or maybe 3 years later. They do change. Some of them let down really well and they kind of get a walk and come out training quite jarred up. And you need to give plenty of thought to the conformation of your mare, and also if she's had a couple of foals, what she throws. Does she have a habit of throwing small foals, or foals that toe in or toe out, you know, so on and so forth? Or does she throw bigger than herself? And then have a look at your stallions, and really you should be able to visualize that stallion in your sleep when you decide to mate your mare to it. Like, I'd be surprised, and you know, some people will bring mares to me and the first time they see the stallion is in the covering shed. And then they're trying to have a look at him, and he's, you know, he's on 2 legs, he's going in to do a job. He doesn't present himself in the best, you know, demeanor. And they're like, will you give him a walk? And sure, he's after just providing, you know, doing his job, and all he wants to do is go back to the stables, you know, and lie down, you know, and have a rest or a roll. We put him in a sandbin. So please, if you can, you know, it's not the greatest time to see them. And you might say, sure, look, I live, you know, I'm down in Cork, Micheál, I can't get up to you, you know, but look, you're going to be writing a check potentially for 4, 5, 6, who knows how much thousands you're going to be invoiced for. It's worth the diesel or the petrol in your car to go and look at the stallions, you know, and give them, you know, and if you can, it's very possible now that when you look at stallions, you can look at their sires they're by. So if you went to look at Minzal in Durranstown, you can have a look at Maymass and Tally-Ho. You compare them to Supremacy, and you get a gist of what the Maymasses are like in general, maybe, you know. So definitely do that. And if you're thinking of using a stallion, buy a Pacific stallion that there's a few of them around. So do consider conformation and size. And when it comes to size, listen to Lorraine, feed them as much as you can. Don't cut back in feeding them. That's something I highly recommend. But, you know, in general, you can only give size, you can really take it away, you know? So do be conscious of size of your mare and what she throws and the size of the stallion. And there's no point finding out, well, yeah, geez, you know, it transpires, the mare just throws them small and you were using a load of little buddy stallions, like I have some buddy stallions, you know, and then it's a bit too late then. You arrive up to the sale, your little Tellwell pony, and then say, well, it's too small, you know? And you've after, you know, investing a lot of cost and time into it. So I've spoken about first season stallions. In general, they can be in demand at foal sales. Obviously, they're unproven, but they're new and they're shiny. People like using them, people like buying them, and it could be your only opportunity of using the stallion before he makes it. So obviously, when you go in and you use the people who would have used Maymass, for example, or whether it's Kodiak, Archangel, in the early days, maybe sometimes you're not in a situation to use them now that are standing at much higher fees. Also, if you click with the right first season stallion, and for example, if you sent your mare to Havana Grey, and then Havana Grey has clicked as a leading first season stallion, your mare then gets upgraded massively. And she could breed then that stakes winner or that black type performer that makes your mare. So there is a huge uplift for using first season stallions if you pick the right one. Which one's the right one? I don't know. Nobody does, you know. But, you know, it's a game of opinion, so make your opinion and run with it. Proven stallions, I'm a huge fan of them. But we have a very, very small supply of them. In general, your 2 go-to stallions, in my opinion, is probably Cody Bear and Caught High Glory, 2 very proven stallions that, you know, have bred good coats and good fillies on both sides. The market likes them, trainers like them, and you have an opportunity of breeding to a stallion that can produce a Group 1 performer or a Group 1 winner. However, they are 15,000 and 12,500, so they are not in everyone's pocket, you know. After that, then, you know, we're probably short both in England or the UK and Ireland for proven stallions. Camacho's no more with us. You have Equine and Asha Stud, but in general, a proven stallion is a very good stallion to use when you have a maiden mare that you want to get a winner on the board, you want to get her first foal into the system. I would highly recommend a proven stallion for that maiden mare to get her up and running. And sometimes people, and I'm at fault, will use just first season stallions on a maiden mare for the first 2 or 3 covers. And if I picked a couple of bad stallions, I use my own stallions. Say I've covered her with Capella, Sansevieria and Stratburn. And suddenly the mare could have been a great mare, but she went to duds of stallions. So we'll never know. And now the mare's a dud. So, but it's very hard not to use a first season stallion when there's a demand there in the sales ring. Also, I described some stallions as kind of limbo stallions. A limbo stallion would be a stallion who's going to have his first runners or potentially sell his first yearlings. And so a limbo stallion, we could say, is Inza Court, Invincible Army, G stallions, a soldier's call. It's going to have a first runner. So they're very high risk stallions to use now because you're going to have your mare covered in the springtime. It'll foal next spring. And by 2024, this stallion could be living in sunnier climes. And that's no good for you when you come selling your foal or your yearling, or else he could be the bee's knees. And you're smiling like a Cheshire cat going, geez, I got this right, you know? And it'd be huge demand for your offspring. So it's high risk, high reward, but be careful when you're doing your mating plans that you don't go knee deep in just first season stallions or knee deep in proven stallions or knee deep in limbo stallions. Try to vary it so you have every angle covered. So if you did click with a right limbo stallion, you're okay. But if you didn't, you still have your proven stallion to come through to maybe clear your decks, and maybe you have your first season stallion as well that might produce a nice foal and sell reasonably well. And that's me. So any questions, feel free.
Yeah.
Micheál, I've just a question. You mentioned rotavirus, which is a whole other hornet's nest, but I'm just wondering what your feelings are about people coming with mares and leaving their foals at home for cover. I'm always trying to persuade people to leave foals at home for that reason. Yeah. I'm just wondering what you think about that.
I'm a huge fan of it because it's less labour intensive for us. First and foremost, you know, this because some people the foals might be well handled and you can put it with a head collar on them and you can lead them around the place, you can hold them while the mare's getting the boots on, etc. But sometimes they come off the ramp and they're gone 50 yards, and then they're kind of looking, oh, he's not normally like this, you know. But just, you know, and you know for a fact they probably rammed his foal into his box and maybe pushed up with a bale of hay, who knows? So, and you know when the box arrives if the foal has been handled or not, because if you hear a racket, you know. So, and there's nothing worse than trying to go in there, put a head collar on a foal that's never had a head collar on, and try to put a rope on it and try to lead it out, because everyone gets upset then. So I would advise people, if you can, and if you have a facility at home where it's safe to leave the foal at home, you know, a safe stable, please leave the foal at home. You can speak to your vet, get a bit of settling, something like that does the job, both for mare and foal. Some people said to me, I leave the foal at home when I go far, because if they travel a long distance, the mare forgets about it. And sometimes I think maybe it should be the other way around. If you go far, maybe bring the foal, because the foal's left alone not drinking any milk. But in general, rotavirus is an issue that I think we're going to be speaking much more of in the coming year and future. And this new variant, I'm no vet, I'm no expert, but it's kind of when the virus doesn't fully work, or the vaccine doesn't fully work for it, and it knocks the foal 2 or 3 days after it's born. And most foals will probably have to go on a drip and get a lot of meds to get right. And so in general, a common thing for that would be a stud farm like myself would have a lot of traffic of mares and foals. And if you can, leave your foal at home in your home environment where the foal is, you know, in a clean, good environment, so the foal's not coming into a loading bay area or into a stocks area that's seeing a couple of hundred foals coming through. We have a pressurized tank and we have a power hose and we wash it all down with disinfectant. But there's still certain things you just can't really, you know, look out for. What's interesting is, and I hope, is anyone here from Kildangan or Godolphin? No. They bring their foals all the time, which surprised me because I thought they would leave their foals at home. But they bring the foals, and they would have the clientele and the staff and the setup I thought that would suit to leave foals at home. But wherever they go with a mare, they bring the foal. But you know,
they're all probably fully vaccinated.
True.
Expensive mares.
Yeah,
but feel a bit safer.
But in general, things can only go wrong with the foal there. You know, sometimes you have a difficult mare, and if she can't see the foal, she gets upset. But hopefully by the time she arrives to the stud to get covered, she is, we can deal with her. But when the foal is there and the foal is upset as well and the mare is upset, it's very hard to kind of calm everything down. You might just put them in the stable, take a break, cover the next mare and go back to them. But I could be wrong, there's not many situations where having the foal there helps the situation.
That's interesting, because usually when I recommend to people to keep the foal at home from a rotavirus point of view, they always say, oh, the mare mightn't go and foal because she'll be upset. So it's interesting that you find the opposite.
I haven't seen, if that's the reason, I don't know if there's any scientific proof why the mare doesn't go foal, the foal's not there. I mean, the foal's not exactly in the covering shed. Looking at the mare per se. Okay, we have a stable beside it, but I can't see what the foal actually brings to the situation, bar a bit of upset for everyone, and it's different if they're well handled. But the reason why mares don't go and foal varies so much, and I think the foal not being there, if it makes the list, will surprise me. It cannot be high on the list.
Oh yeah, I agree. But just getting back to the rotavirus, you mentioned that the vaccine, I don't think the vaccine we have here at the moment is effective against the American strain. But, I didn't mention rotavirus just because the talk I was doing was kind of immediate postnatal care. But the vaccine is extremely effective. I don't think I've ever seen a bad case of rotavirus in a fully vaccinated mare. You might get a mild case, particularly, when they're 4 or 5 months and their immunity is waning. But rotavirus is definitely a disease of intensification. So if you can keep foals away from those boxes and, keep them, away from large numbers of foals, it's usually much easier to manage. So it's back to the basics. If you vaccinate your mare and keep her away from those high risk areas, then, that usually sorts rotavirus out.
Oh, here to that. No, but I can't highlight how serious rotavirus is, especially this new strain. But vaccinate your mare, it's not, it's a couple £100, but in the long term, it's a lot cheaper than putting a catheter into your foal, or putting fluids in your foal and having your vet out on a regular basis, giving a lot of medication. And also, not just because, Micheál's being selfish here, he wants you to handle your foals, but do handle your foals. It does help you in the long term when you go to wean them and to prep them and so on and so forth, that you have a good relationship with them, that you're not, having a boxing match with them and fighting with them and, so on and so forth. There's kangaroo coming at you, So please do handle your foals as much as you can. It doesn't go into your mating plan, but do.
I suppose on the topic of that rotavirus as well, we have a webinar on our website and also on YouTube, where we invited Dr. Emma Adam to speak about her experiences with rotavirus in Kentucky. And yeah, as you both said, Micheál and Andrea, it's incredible to see the prevalence of it over there. And it's probably only a matter of time before it does become wider spread. But great if anyone wants to jump on and have a look at that. But we have another question here.
Micheál, would you alternate year to year from going from a first season stallion to a proven stallion, even if you're always looking to breed commercially for the foal sales?
I think you would. A lot of it just depends on what stallions are available. Okay. We don't have the same stallions available every year. The market changes very quick. Come the end of the year, some stallions will cut the mustard and they stay a stud, and others go to sunnier climes. So, in an ideal world, depending on what everyone wants to breed winners. And by doing that, we want to breed commercially that it hopefully pays for itself. And, sorry, that's my phone. I'll just turn that off. If you can, it's a great suggestion to rotate it, that your mare is not exposed with 3 or 4 first season stallions. Yeah. But not every year is there a proven stallion maybe affordable in your budget. But no, I could definitely look. It's a great suggestion, and do what's best for you and your mare. But definitely proven stallions and rotating them is not a bad thing to do.
Just one more follow on from that. Then, if you want to get to a proven stallion, and you've expended your budget the previous year, would you recommend a stallion nomination then to get you through another year for? What do you mean a stallion nomination, like a foal share? Or? A foal share, sorry. Foal share. If your mare is suitable for a foal share, something I didn't mention is when you're selecting your stallion, in an ideal world, your mare pedigree is up in 20% of that stallion's book. In reality, most of our mares, and my mares anyways, are all the same. And there's no, I don't have a glorifying group producing mare that suddenly, goes up bracket, they're all young mares having a chance, hopefully breed through winners. So when it comes to using stallions in a 20 grand bracket or down,
In reality, most mares are the same caliber, because obviously if you have a mare who's produced multiple stakes winners, you're not using a stallion in the 20 grand back bracketed out. You're probably using a much higher expensive stallion or foal share into a very high-end stallion. So the 20% doesn't really count, I think, in the bottom end of the market, or the lower tier, I should say, maybe not bottom, lower tier, because we all have the same mares. We all have young mares, hopefully breed a few winners. Foal shares are good. One negative about foal share is that you can see the sales results where you have a mare going in, or foal going in, or a yearling. Sometimes these foal shares go as yearling, that the mare got a foal share to a stallion, and the stud farm, depending on the stud farm, can be keen on them because they want to get the numbers up. And by providing a foal share to get a mare into the stallion, but also prevents that mare and potential breeder going to another stud farm and another stallion. So it's a bit about market share. But then you arrive to the sale, and your mare and your resulting offspring, how nice it is at a lower pecking order than the rest of them. And the reason it's a lower pecking order isn't always to do with the fact that it's your mare and your foal, but in general that if someone's willing to pay a high-end nomination fee for a stallion, will just, I don't know, Camelot 60,000, for example. The likelihood is that mare is a very good mare if someone's paying 60,000 nomination fee. And you see sometimes maybe the mare that got the foal share to Camelot probably was over-covered with the 60,000 nomination. Maybe she should have went to a 10, 15, 20,000. So it is tricky. I do recommend it. Some people love sending maiden mares on foal shares. Now, I speak about foal shares as if they're all out there to be used. Like, you know, it's very mare by mare case and breeder by breeder case. They're not just, you can't just ring them up and say, look, can I have a foal share? And sorry for this. So the reason people would use a foal share on a maiden mare is that you don't know what the mare will throw. The likelihood is the first foal can be a bit on the small side, and it gives you that you're not writing a check for 10, 15, 20,000. But yet you're breeding to a proven stallion and you have a resulting foal. And if she produces a good foal, you say, okay, if this mare is worth a bit more investment, maybe instead of going foal sharing, I'll look at a stallion and pay a nomination fee. So, you know, there's pros and cons for it. Pros and cons for it.
Thanks a million.
That's it.
Super. Thank you very much, Micheál. So I think we'll probably wrap things up there. Thank you again to all of our speakers for giving their time today. Thank you everyone for coming, and thank you to my webinar for holding our hybrid event. Probably plenty of nuggets in there and loads of information for everyone. If you're not already starting foaling, maybe you'll start in the next couple of weeks. But, you know, there's so much information, and if you do have any more questions after the event, you can always drop myself a call or an email and we can get you in touch with our speakers. Other than that, I suppose, Micheál, you mentioned going out to look at your stallions. The ITM are holding their stallion trail on the 13th and 14th at the end of this week, Friday and Saturday. It's a great opportunity to get out to those stud farms, to have a look at those stallions and to talk to the nominations teams. So it's all on their website, itm.ie. If you have any kind of interest in going, it's a great opportunity to get out. Other than that, I would say thank you everyone for coming today, and a safe home in the pretty horrible weather out there. Thank you again.